Good morning, everyone. So I'm Kelly Coons here from the School of Rural and Northern Health at Laurentian. So my research surrounds fetal alcohol spectrum disorder, or what I'm going to refer to as FASD. So FASD is actually quite prevalent, and more recent research is suggesting that it actually may be much more prevalent than we originally thought. Some data coming out, 1 in 20 individuals affected. And so many people should be involved in the care of individuals with FASD, but my research focuses specifically on healthcare providers, specifically students. So students have been participating in an ongoing mixed method study to assess their knowledge, perceived knowledge, and self-efficacy regarding addressing FASD. And so what we're finding is that students really report a real lack of knowledge about FASD, so they're not educated about it in their programs. And as a consequence, they really feel they perceive themselves not to be very efficacious or have a good ability, both in working with individuals with FASD and their families. But on the positive side, we do see that they're more comfortable addressing the alcohol consumption piece specifically, especially when it comes to pregnant women or women of childbearing age. But unfortunately, what we do see is that they do acknowledge that the best and safest recommendation is no alcohol during pregnancy. Some of them do say no alcohol is recommended, and discuss exceptions to that recommendation. And as well, they report feeling much less comfortable with women who struggle with mental health and addictions issues. So in terms of addressing perhaps binge drinking and so on, that's much more of a challenge. And so hopefully the implications of this study are going to be in regarding changing the healthcare curricula. So I'm specifically in Northern Ontario, and we're looking at medical students, midwifery students, and nurse practitioner students. And I'm also using vignettes as part of my research. So the goal is to have the vignettes integrated into the curriculum as a case-based learning tool. And then much more broader in terms of hopefully increasing the knowledge and self-efficacy of these students. So when they do go into providing clinical care, that they feel much more prepared to do so. Thank you.